Hello, my name is Lisa Whaler, and I am the Director of Practice Operations for Wentworth Health Partners. I'm joined by Dr. Matthew Goldberg, Chief Medical Information Officer for Wentworth-Douglass Hospital. Today, we're going to be discussing virtual medicine. Thank you for joining me, Dr. Goldberg.
Hi, sure.
Can you tell me what virtual care or virtual medicine is?
Virtual care is really care that's not delivered in person. So typically that's by video conferencing or telephone or e-visits, which are like structured email. These days we tend to interchange the term virtual care with telehealth, which refers really to either video visits or telephone visits. So it can be a visit with a physician, a PA, a nurse practitioner, a nurse midwife, care manager, behavioral therapist, dietitian, all of these disciplines, all of which we offer at Wentworth-Douglass.
Thank you. And what types of visits can be addressed using virtual care or virtual medicine?
Many types of straightforward visits or visits where that are discussion focused. So we can address some simple physical ailments or issues depending on how much of a physical exam is required. We do a number of follow-up visits and counseling or discussion focused visits virtually. So if there's something keeping a patient out of the office, whether it be difficulty with transportation, or they're compromised, or they have viral symptoms similar to COVID, then at the time of the scheduling, they're offered a virtual care option where appropriate.
Okay. And what if the patient lives outside of New Hampshire?
So while the COVID pandemic helped accelerate our use of virtual care, video visits, telehealth in general, much of this occurred under a state of emergency where federal and state rules around healthcare delivery were loosened a bit. But now that in-person visits are easier, different states and the US are re-examining the rules so we can continue to offer virtual care, but do it in a way that respects clinicians' state licensure, but also continues to improve convenience and access for patients. So the rule is this: the provider must be licensed to practice in the state where the patient is physically located at the time of the visit. So if you live in Maine and want to have a virtual visit from your home with a New Hampshire provider, then the provider needs to be licensed in Maine. If your provider is licensed in Maine, then the visit can be held virtually. That's one example.
Okay. And does insurance cover virtual care?
It does. This is currently in flux. Again, post-pandemic emergency, different insurance companies are re-examining what they will and won't cover. But for example, certain insurers may cover some types of visits, but not others. And copays for virtual visits are becoming more common. So patients should check with their insurance company to see what their current plan covers, what their options are for virtual care.
Okay. Is there anything else you think our patients would need to know or would like to know about virtual medicine?
I would just reiterate how convenient it is. And we've been doing this for a year and a half now. We're getting better and better at it. Our tools are better. It's a secure conduit. What we're able to discuss and offer without having to come in person is really valuable. So it's something that they should ask about when they're scheduling a visit.
Great. Well, thank you very much for your time today. And if you would like more information on virtual medicine, you can visit our website at www.wdhhospital.org. Thank you.